So is this a good thing? And did you know this? There are a lot of states, especially the bigger states, that give not necessarily illegal, but migrants that aren't citizens health care. And now multiple Democrat-led states are rolling that back or freezing it or completely ending health care coverage for undocumented migrants. California Governor Gavin Newsom proposed freezing enrollment of undocumented adults in their Medicaid program. Illinois Governor Pritzker is ending the immigrant adult health program at the end of the month. Currently covers more than 30,000 low-income undocumented adults. He's keeping it for kids. Minnesota Governor Tim Walz agreed to end their health insurance program for undocumented adults. Again, kids are a carve-out in order to get a state budget passed. Now, all of these, each and all of these states are saying, yeah, the economy is so lousy under Trump, they can't afford it. Is that what it's really about? And is this a good thing? How does the man tasked by the president to run Medicaid and Medicare see that question? Let's ask him. Dr. Mehmet Oz joins us now. Doc, good to see you. Thanks for coming.
Thanks for having me on, Chris. Let's just address what's the obvious reality of going on with the three states you mentioned, and others will follow. It's very easy to be generous with someone else's money. So in California, for example, where there's over $6 billion over budget on Medicaid, in part because they're covering illegal immigrants, they were hoping the federal government would cover 90% of the costs because most of these illegal immigrants are able-bodied individuals, and so they can collect Medicaid. The federal government matches them at 90%. It's pretty easy for the governor to say, you know what, we'll put them on Medicaid, not a big deal. Someone's going to pay it for us. Same in Minnesota, where they actually ended up with 3 times more illegal immigrants enrolled than they expected. And of course, that busts the budget. Same in Illinois. So my job is to accomplish what the president has asked over and over, which is align the needs of the federal government with the states. If we do that together, we'll be able to help the most vulnerable Americans for whom Medicaid was designed to support. And that is the passion we all have here. Whether you're in rural America, urban America, underserved areas, we want to make sure that Medicaid is there for you. But if we extend it to illegal immigrants without keeping tabs of what those costs are, and especially if we have a system that encourages states to do legalized money laundering, to push more money towards able-bodied individuals, Chris, the dollar doesn't stretch that far. You end up bankrupting the whole system. And Medicaid has grown over the last 5 years, 50%. 50%. And we've got a fraud issue in the Affordable Care Act, the exchanges, that we think is about $25 billion. So we've got to clean up the fraud. We do that by getting governors to work with us.
Great. Look, get rid of WFA, waste, fraud, and abuse. That's always good. I mean, it's pennies in terms of what you guys spend with the entitlements or Medicaid specifically, but that's okay. It doesn't mean you shouldn't find the money. Now, 2 of those 3 states, I give it to you, Doc, straight up. California, not as much because they give more to the federal government than they take. All right, they're a rare state that way in terms of the size of that economy. But here's my concern. I thought that part of the reason they were doing this is because it's really expensive to treat these undocumented adults and their kids without doing it this way. That, you know, the burden on the emergency rooms and, you know, and what the care cost was, that it was actually more affordable to do it this way, and they were seeing bad outcomes with kids. And my concern is that these guys are just doing this because they're afraid that it's a bad look with the state of politics right now because the Democrats have been too permissive when it comes to undocumented migrants.
Well, there's no question that the inability to take seriously the challenges of taking care of a large population of undocumented folks has become a problem. And states have to manage that. But for many years, 4 in particular, there didn't seem to be much of a concern about illegal immigrants coming across the border. So it's a big problem. Everyone's got it. It's not just isolated to California, but it does seem to be a bit of a louder problem there. But at our agency, at CMS, we have an obligation to take care of the people for whom Medicaid was originally designed. And the emblem is right there. When you walk into the building where Bobby Kennedy and I work, it's the Hubert Humphrey building. There's a quote from him, and I'll share it with you. It's the moral obligation of government to take care of those at the dawn of their life, the children, those at the twilight of their life, You know, those are the older folks, mature folks, and those who are living in the shadows. That's who the program was designed for 60 years ago. So we've got to protect the program for those folks. Putting able-bodied individuals onto Medicaid is a problem because, especially if the government's paying all the money, you embellish the program. You put extra support behind it. You grow the budget of those programs, and there's not enough money left for everybody else. I'll give you one more challenging reality. Fact that's unfortunately true in more than half the states, we believe. If you're a able-bodied individual going for health care, you will get your doctor paid more money than if you're a mom with a sick kid. So an able-bodied person with no kid doesn't, pays better than a mom with a sick kid. That's wrong. I'll give you a worse scenario, maybe. Seniors who work their whole life paying almost 3% of their total salary into Medicare, when they go to a doctor, they don't pay their doctor as well as an able-bodied individual on Medicaid. That's wrong. When people hear about this, they get really upset. So these governors have heard the siren. They're reacting to it, and you're going to see it happen in more states.
Dr. Oz, I appreciate the perspective. As you work your way through what the solve is here, what will make it better, and that becomes part of the debate, you're welcome back to make the case to the audience. And thank you for doing so.
Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.